Feeding your baby. Breastfeeding, chest feeding, and breast milk.
The term breastfeeding doesn't apply to everyone. There are many reasons why some people choose to use the term chest feeding. For example, transgender or non-binary people and those who have experienced breast removal or past trauma. We'll talk about both breast and chest feeding throughout. Whoever you are, whatever your journey, please feel included. It's never too early to start thinking about how you're going to feed your baby. It's up to you which method you choose. You don't have to make up your mind until your baby's born. Breastfeeding or chest feeding has lots of benefits for both you and your baby. And your breast milk is tailor-made for them. The first milk you produce is called colostrum. It's packed full of nutrients and protective factors. You might think of colostrum as a superhero version of breast milk. Colostrum is concentrated goodness and it's designed to be available in small amounts. It has a laxative effect to make their poo soft. Lots of soft poo helps to minimise jaundice. You might hear us call the early baby poo meconium.
Benefits of breast milk. There are many reasons why breast milk is amazing for both you and your baby. It contains at least 34 ingredients not found in infant formula milk. It protects your baby from developing allergies or serious illnesses such as infections, diabetes, asthma, heart disease, and obesity. It reduces the chance of tooth decay. It contains growth factors to help babies born prematurely with their development. It reduces the chance of cot death, which is sometimes referred to as sudden infant death syndrome. You can take it one day at a time, but the longer you breastfeed and the more breast milk your baby receives, the greater the benefits. Benefits of breastfeeding. Breastfeeding is good for your health too. It reduces your risk of developing breast and ovarian cancer. And the longer and more exclusively you breastfeed, the better your protection. Benefits of hand expressing. Hand expressing during pregnancy can be helpful to get familiar with your breasts, practice your technique, and collect milk before your baby arrives. Hand expressing when your baby is here can be useful in various situations, such as if your baby isn't feeding or latching on well, to help stimulate your milk production, your breasts become very full, you need to target a blocked duct. How to hand express. Wash your hands and prepare a sterilised container, cup, spoon, bottle or bowl. Get comfy. It can be helpful to start by gently massaging your breasts. Cup your breast in a C shape using your finger and thumb 2 cm to 3 cm back from the base of your nipple. Your finger and thumb should be opposite each other. If you imagine that your breast is a clock, your thumb would be at 12 o'clock and your finger at 6 o'clock. Gently press your thumb and fingers together, release your fingers and repeat in a rhythmic movement. It may take a few minutes, so be patient. Gradually, your breast milk or colostrum will be seen on the end of your nipple. When you notice your milk flow slowing down, move your hands around your breast so you are expressing from a different area. Position your finger and thumb at 11 o'clock and 5 o'clock and repeat the process. Once you've expressed as much as you can from one breast, repeat the process on your other breast. How to get feeding off to a good start.
The next section is all about what happens after you give birth. Please remember, if you have any questions about feeding your baby, you can always ask your midwife or health visitor. Straight after birth, that first hour is an important time for bonding and undisturbed skin-to-skin contact. Doing this immediately after birth has so many benefits. We call it the golden hour.
What to expect during the golden hour. Skin-to-skin contact. Skin-to-skin contact is calming and relaxing for both parent and baby and reduces the level of the stress hormone cortisol. Did you know that a friendly bacteria can be found on the mother's skin that helps to protect babies against infection? Other great benefits include stimulation of your baby's digestion, making them keen to feed, regulation of your baby's breathing, heart rate and temperature, promoting a gentle transition to life outside the womb, stimulation of hormones that support breastfeeding and nurturing. Holding your baby skin to skin during the golden hour promotes strong instincts that help them adapt to life outside of the womb. Here are some of the behaviours you can expect to see. Birth cry. Most babies will give a loud cry at birth to expand their lungs and initiate breathing. This will subside as skin-to-skin contact is started. Relaxation. As your baby rests after the effort of birth, they will begin to calm down. You'll notice their breathing becomes more gentle and their hands are soft and open, awakening. Around 5 minutes after birth, your baby may start to move their head and shoulders and begin opening their eyes and mouth. Activity. Your baby's movements will increase and they will begin to show signs of rooting, meaning they are looking for their first feed. Rest. Your baby may rest again. Periods of rest in the golden hour are normal. Crawl. Your baby's stepping reflex will allow them to crawl on you. This instinct is there to help them find their first feed, and they use it to make their way to the breast. Familiarization. Your baby will familiarize themselves with the breast through touching, licking, and small sounds to gain your attention. This will raise your oxytocin levels, creating a strong attachment with your baby and signaling your body to start milk production. Suckling. Your baby will now feed. Sleep. Now is the time for you both to sleep to provide rest and recovery after birth. However you choose to feed your baby, you may want to experience skin-to-skin contact after birth. If you're unable to hold your baby straight after birth and you have a partner, they can have skin-to-skin contact with your baby until you are ready to take over. We understand that everyone is different, and your midwife will be there to support you in this first hour after birth. Your midwife will offer to weigh your baby and do an initial examination to ensure all is well. This can all be done after this initial hour, unless there are any concerns. Remember, babies need a lot of love and attention as they get used to their new world, and it's not possible to spoil them. Your baby has been close to you during your whole pregnancy, so being held and comforted will help them feel safe. Breastfeeding and chest feeding myths.
You may have heard some myths about breastfeeding. I'm here to bust those myths and give you some expert advice and top tips. Myth 1. Breastfeeding hurts. Some people can experience discomfort in the first few days of breastfeeding. This is normal, as both you and your baby are learning how to feed. If you're experiencing pain or discomfort during feeding, you can ask your health visitor or the infant feeding team for support. There are plenty of positioning and attachment techniques that can help you. Myth 2. Breastfeeding mothers get less sleep. However you choose to feed your baby, your sleep will be disrupted at some point. Some babies sleep for longer periods and others short bursts. How you choose to feed your baby does not influence how long they sleep. Myth 3. Breast size affects milk supply. Breast size or shape does not impact the amount of milk your breasts produce. Regular feeding with good positioning and attachment will have a positive impact on your milk production.
Breastfeeding and chest feeding. Commonly asked questions. Many people have very similar questions about breastfeeding. You're definitely not alone in wanting answers. Here are some of the most commonly asked questions. How do I know my baby is getting enough milk? There are lots of signs that you can look out for to make sure your baby is getting enough milk during feeding. Their cheeks stay rounded, not hollow, during sucking. You can hear and see them swallowing. They seem calm and relaxed. They come off the breast on their own. They appear content and satisfied. Their mouth looks moist. They will have wet and dirty nappies. Your breasts feel softer and your nipples look more or less the same, not flattened, pinched or white. Do I need to take supplements when breast or chest feeding? You should continue the 10 micrograms of vitamin D you have been taking during pregnancy for the duration of breast or chest feeding. What does my milk coming in mean? Around day 2 to 4, you may notice that your breasts begin to feel fuller. This is often described as your milk coming in. Your colostrum is all your baby will need until this change happens. What is responsive feeding? Responsive feeding involves you responding to your baby's cues as well as your own desire to feed them. Feeds aren't just for nutrition, but also for love, comfort, and reassurance. Feeding your baby this way ensures their emotional needs are met, supports brain development, and promotes and improves health. How long should I breastfeed for? Everyone's breastfeeding journey is individual, and you can continue to feed your baby for as long as you wish to. It's recommended that exclusive breastfeeding should continue for 6 months. After this, breastfeeding alongside solid foods is best. How can my partner help? We would encourage your partner to attend any classes with you, so they understand what will get your breastfeeding journey off to the best start. There are so many other ways your partner can help you. It might be skin-to-skin time, nappy changing, or bath time, or even making you something to eat or drink is helpful too. Feeding your baby isn't the only part of being a parent, although it can sometimes feel like that. Do I need to wind my breastfed baby? Babies who breastfeed create a different suction to those who bottle feed, which means less air is swallowed. Often a breastfed baby will not need winding, but if they do, they'll soon let you know. Why does my baby feed so often? Your baby's tummy is tiny. At birth, it's the size of a cherry and will hold about 1 teaspoon of milk, so they feed little and often. At 3 days, it's the size of a walnut. At 1 week, it's the size of an apricot, and at 3 to 4 weeks, it's the size of an egg. Take a moment to think about everything you have eaten and drunk today. You might have started your day with a cup of tea, and then an hour later had breakfast. Add in some extra glasses of water or juice, or a coffee mid-morning, maybe even a snack. You will find that if you count everything you have eaten or drunk in a day, it might be 10, 12, or even more items. You are supplying everything you eat and drink to your baby, and there'll be a few extra feeds in there just because they love you. Positioning and attachment.
Breastfeeding is something that you learn together. Good positioning and attachment is important for it to be successful. Finding a comfortable position means you can feed for as long as you wish.
Positioning. It may be useful to remember the word chin when thinking about positioning your baby. C. Close. Hold your baby's whole body close to you. H. Head free. Place your hand along your baby's back with your hand on their shoulders so their head can move freely. I. In line. Ensure their head and body are in line. N. Nipple to nose. Your baby's nose should be in line with your nipple. This will allow them to latch effectively. Attachment. You want your baby to have a wide open mouth. By tilting your baby's head back slightly and brushing your nipple against the top lip, you can encourage their mouth to open. When their mouth is open, you can then encourage them onto the breast, making sure that their chin is leading. Here are some signs that your baby has latched on properly. You may see more of the darker skin of your nipple above your baby's top lip. You will notice your baby's cheeks will appear full and rounded. Their chin will be indenting your breast. Their nose will be free. Their head should be unrestricted. Their mouth will be wide. Once your baby has attached to the breast, there is often short, rapid sucks to start with. This will then flow to a more rhythmic sucking pattern. This sucking pattern may not be as evident in the first few days. Feeding positions.
Depending on what makes you comfortable, you may wish to hold your baby in different positions when you are feeding. As long as you follow the above principles, they can all work for you. Here are some examples of positions you may like to try. Cradle hold. This is the position you will see lots of people feeding in and is often easy to do when you're out and about. Make sure you're sitting comfortably before starting your feed. Crossbody, sitting upright in a chair with your feet flat on the floor. Laid back. When you've had a cesarean birth, laid back feeding can be a really effective way to feed your baby. Lying in an upright position is often most comfortable and it makes it easier to gently guide your baby to your breast. Side lying. This position is often used when feeding at night. It's a really effective way to get your baby used to latching comfortably in the first few days. Laying on your side and getting your baby into the correct position is very important. Then support their back with your arm. Rugby hold. This is a good position if you've had a cesarean birth, as there is no pressure on your stomach area. It is also useful when feeding twins. Many people use this position and find it comfortable. Sitting upright, position your baby by your side.
Equipment and sterilisation.
If you decide to give breast milk or formula in a bottle, it's important you're confident with sterilising, making up feeds and storing breast milk safely. There are many different methods for sterilising. It's best to familiarise yourself with your chosen method before your baby is born. Before you make up your baby's feed, ensure your hands are clean, the work surface cleaned down, and your bottles, teats or feeding system is sterilised and ready for use. When making up formula, it's important to make this as per the manufacturer's guideline on the tin, tub or bottle. We advise you only use a first infant milk until your baby is 1, and then move on to a full fat cow's milk. There's no need to buy follow-on milks. When storing breast milk, we recommend that you always store it at the back of the fridge and not in the fridge door as the temperature varies too much. If the temperature in the fridge is less than 4 degrees Celsius, it can be stored for 5 days. If the temperature is 5 to 10 degrees Celsius, then it can only be stored for 3 days. You can also store breast milk in the freezer. If your freezer is at minus 18 degrees Celsius or lower, it can be stored for 6 months. You can defrost breast milk in the fridge or at room temperature. Once defrosted, it's important to use your breast milk straight away. If you have breast milk that you haven't used and is no longer suitable for feeding to your baby, you can always use it in the bath to give your baby a breast milk bath. If your baby is born earlier than expected, please speak to your midwife about breast milk storage.
Responsive feeding. As you start to get to know your baby, you will instinctively start to recognise their different cues and know when to feed them. They may be moving their head from side to side or putting their hands inside their mouth. Crying is a very late stage of hunger, and it may be best to calm your baby down before offering a feed. Some skin-to-skin time, talking to them and rocking them can all help to calm and soothe your baby. Establishing a feed. When breastfeeding, offer one breast first. Your baby will latch and begin to rapidly suck to get the milk to start to flow. As the flow starts, they will change their sucking pattern to longer sucks with swallows and pauses. As the feed continues, the pauses will become longer, and as the feed comes to an end, your baby should come off the breast relaxed. Winding your baby before offering the other breast is recommended. Your baby may not want any more milk. They sometimes feed for 30 to 40 minutes, and sometimes just for 5. When you come to feed your baby next time, use the other breast, even if you finish the last feed from this breast. Using bottles. If you decide to give your baby their milk via a bottle, it's always best to limit the amount of people who give the bottle to just the parents. This encourages all of the wonderful parent and baby bonding we've already discussed. Pace feeding your baby by sitting them in a semi-upright position and holding the bottle horizontally will help them control the flow of the milk. As your baby comes towards the end of their feed, they may not want all the milk in the bottle. You will start to recognise this by looking for cues such as splayed fingers, turning their head to the side and pushing the bottle away. Lower the bottle and wind them. You can offer the bottle again, but if they don't continue to feed, it's important you don't force them to finish the milk.
Everyone's feeding journey will be different. You and your baby are individuals and will learn a lot from each other. There is so much help and support available from midwives, health visitors, support workers and healthy child practitioners. You can always talk to us about your feeding journey.
To find out more, visit sneewellbeing.org.uk/maternity.